Hello and welcome to Western Medicine, the Humanity Behind the Vanity. Here on Talk 1260 KTRC. This is Dr. Daniel Ronel. I'm a plastic surgeon, talking with my wife, Betsy Ronel.
Hi there.
And we talk about plastic surgery and realities and what it's really like.
Yeah, the realities of plastic surgery.
We have a pretty good show today.
Yes.
We are sponsored generously by Sunita Medical, the makers of Artifil, which we use for liquid lifts and lip augmentation and other things. And also, iFlow. And they make something called the Pain Buster, which is an anesthetic pump that I use in a lot of my big cases, which shoots in pain medicine right into the site of surgery.
Good stuff.
Yes, tiny little tubes. And studies have shown that people use fewer narcotics when they're using the Pain Buster. It's fantastic. Thank you to both of you.
Yes.
So what do we want to talk about?
All right, so you're doing a lot more in-office procedures. It saves time and money for the patient.
Right.
So let's talk about the in-office procedures you do.
You know, I do a bunch. I want to talk about what you can do, what you can't do in the office.
Okay, fine.
I think...
Switch it up then.
I mean, there are plastic surgeons who have ORs, you know, operating rooms.
Right, in their office.
My former partner, Dr. Sakura in Albuquerque, a very generous man who's been doing this for about 30 years, he's got an operating room.
Right, we choose not to have one.
Yeah, and Mike Hopkins, he's got an operating room in his own. Yeah, and so you can do just about anything you want to in those. Not big cases that need to stay in the hospital overnight. But then, one step down from that is doing something in a procedure room under conscious sedation. And a lot of dentists do this, and oral surgeons, and ENTs, and some plastic surgeons. And I don't do that. Because that requires monitoring of the patient, because you do kind of knock them out. And right, and you never quite know what's going to happen.
Yeah, there's too many unknowns.
Right, you do it with healthy patients, and I could do conscious sedation if I wanted to. I just choose not to. And then one step down from that is giving the patient a little oral relaxation medicine that they take at home before they come in, and then just doing local anesthesia.
Right, you're knocking them up in the area.
Right, and so when you have the right patient, in fact today I did a neck lift in the office.
Wow.
It wasn't a full neck lift. This was somebody who had had one before, and there was a little discrepancy, but I did liposuction of her neck, and I did a neck lift.
Wow.
And most of the procedure time is taken slowly numbing the patient. That's what took all the time.
Okay.
Because the actual procedure itself didn't take very much time. But if it's done very slowly and carefully, it doesn't really hurt.
Right. Lipo in the office,
right.
on the neck.
And a lot of people who do laser lipo and that kind of lipo, they also do it in the office.
That's all in the office.
Right. When I do lipo, I actually take out a lot more than those office procedures do. So I do it in the operating room. Those are spot
shots. I mean, those are right.
Right. I do big lipo, so I do that in the operating room. But if you have the right patient who can tolerate local anesthesia, and you're just doing superficial skin, you're not really doing muscle work.
Right.
Then it's appropriate to do it in the office, and I think it's safe. If the office is clean and you use sterile technique, it's fine. I happen to do eyelids in the office, upper and lower, and brow lifts. I do a minimal incision brow lift. And I started doing these because I realized I was already doing skin cancer operations in the office, taking out moles and skin cancers and things like that, and it was just the same.
Right.
They just happened to be on the scalp or on the eyelid, and so I thought to myself, why am I doing this in the operating room? If I can do it quickly and safely, I might as well do it in the office.
Why not? And the patients love it. And also, one thing I like is that they're not going under general anesthesia, which is fabulous.
And they save a lot of money.
Thousands of dollars, right.
So,
pretty small cases.
And not everybody is a candidate for this.
No,
there are a lot of people who say, just knock me out. In fact, you would probably be one of those.
Oh, I'm one of those, for sure. Faux shizzle.
Right.
Absolutely. I want to be knocked out, man. But I don't enjoy the idea of general anesthesia running through my veins.
Right.
But I still want to be knocked out.
Yeah.
I do not want to see that knife coming down my eyeball. Okay.
Okay. Having said all that.
So what do you think is safe to do, and what do you think is not safe?
I was just getting into that.
Okay.
That's good. I think a tummy tuck is probably not safe. I think deep liposuction is probably not safe. I think a facelift is not safe. These are under just local anesthesia. Brachioplasty, okay, that's an arm tuck. I'm not sure about that. It could probably be safe in the right person if you do limited brachioplasty.
Oh, okay.
Yeah, that would be fine. But although the procedure could go really well with those, if, God forbid, there was a complication, and that happens to everybody.
Absolutely.
Then you're really feeling like you're far away from the hospital. When
Right.
you've got bleeding you can't control,
That's
if
dangerous.
the liposuction cannula goes into the wrong place,
Mm-mm.
if the patient is just writhing in pain and sweating and their heart rate is going up and their blood pressure is going up, they could have a heart attack. So you need judgment to figure out what is good and what is not
What
good.
about a facelift in the office?
If it's done under conscious sedation with an anesthesiologist, that's fine. But
What about a nose job?
probably not.
That's big time.
Probably not. You can do non-surgical rhinoplasty, which is just injection of fillers, and that's no big deal. It takes
What about the
15
tip?
minutes.
Adjusting the tip.
Depends.
Okay.
Depends. I think you'd have to be really, really good and really fast to do those in the office.
What about facial implants?
Probably not. No.
Really?
Those can be pretty painful. You got to go through the mouth. Again, if you have a setup to do nitrous oxide, for example.
Laughing gas.
Yeah.
Right.
Now that's getting into conscious sedation,
Right.
and sure, that can be done. It's not something I would do under local.
I would not want that responsibility
Yeah.
of that. Yeah.
Right. Just because you could do it, if you've done 500 of them, you could do it in 2 seconds. But if, God forbid, there was a little complication,
Right,
if
what
the
about in the
patient's artery was
501?
right, if the artery was just not where you thought it was, and you get into a big bleed,
No.
then all of a sudden you're not feeling good.
No.
All
Okay,
right.
so those are the things that cannot be done.
Right.
What do you like doing? Go over that again.
You know, like I said, brow lift, upper eyelid, lower eyelid, some limited facial aesthetic surgery.
Lip implant, you do.
Lip implants are very easy to do. I've done hip excisions on people who have just that extra fat hanging over the side
I got some of
their
that.
hips.
Take it off.
Okay,
See
that
you
can be
tomorrow.
done. That can be done
Okay.
in the office.
1 o'clock. Till
All right.
delivery. Okay,
But-
what else? Liquid lifts. What about earlobe correction?
Oh, absolutely. Do that in the office.
And
It's
you-
very easy. We can rejuvenate the earlobe.
Right.
Um,
Minimal neck lift.
Or help. For example, a lot of people have big earring holes
Well,
that
many
will
people
pull
do,
down.
right.
Those are very easy. Those are done in the office
What
too.
about breasts?
Not much. If you need to move a nipple a little bit in somebody who's had a breast surgery and their nipples are a kilter, then that can be done in the office.
Okay.
But anyway, we actually have to wrap things up.
Oh, all right.
So
much fun talking with you.
yeah, maybe we'll talk about it some more some
All
other
right.
time.
Yeah.
You've been listening to Talk 1260 KTRC, Western Medicine and Humanity Behind the Vanity. This is Dr. Daniel Ronel. We're going to take a quick break and then we'll be back. Thank you.